On success lies in brokers area. Just before that, we have a very pleasant task. We have a guest talk by none other than Dr. Arun Sethi about the ambulatory surgical centers standalone versus corporate versus non-profit, which will be for 10 minutes. So I request Dr. Arun Sethi to kindly deliver his guest talk.
Thank you very much. Can you load my talk, please? It's already loaded, I think. How do we start? Yeah. Yeah. So the talk that was given to me was to compare ambulatory surgical centers. So I wanted to tell you that basically what is an ambulatory surgical center? Okay. Just 1 minute. There's some. Now it's okay. So comparison of ambulatory surgical center ownership models, standalone versus corporate versus non-profit. Now if you take an overview of the ambulatory surgical centers that are there, now these are the ownership models mostly based out of US, then I'll show you the international also. Now why do people go in for an ambulatory surgical center? It's more cost effective, it's easier to manage your surgical list, you do not have to wait for turns in, because I work out of a multi-specialty hospital as well as an eye institute. So in a multi-specialty hospital, you are stuck with many times between two cataracts you have to come out because they need the theatre for a road traffic accident. Infection rates go higher because right before you somebody's done a kidney transplant, because most of these hospitals do not invest in a separate eye theatre because they say the returns are very poor. Secondly, in an ambulatory surgical center you find that the staff is dedicated and knows exactly what you want in terms of your anesthesia, in terms of instruments for surgery. So it has a lot of advantages and cuts down the cost. Now, there are three types of them. One is standalone, which is physician-owned. Second is corporate-owned, like we have the chains now in India also. And the third is the non-profit, which is on the side of those who run it like a trust. So, definition of an ambulatory surgical center is an outpatient facility specializing in same-day surgical procedures. So, patients should not stay overnight. Now, what is the role in healthcare? They provide efficient, cost-effective surgeries. They reduce hospital burden by handling routine procedures. They offer faster recovery and personalized patient care, and they integrate advanced technology for precision treatments. They also enhance accessibility, affordability, and quality. That's a fact. You know that 7 years ago, American ophthalmologists were getting around $2,800 per cataract surgery for ECC or PCIOL. As they kept saying that they're doing 3-minute, 5-minute cataracts, now it is down to $650. The equipment cost has gone up, but the reimbursement costs have come down. So now they've actually started issuing instructions that you cannot tell a patient or give any advertisement claiming that you do under 5-minute cataracts, because the insurance company says now we'll pay you according to the time of surgery. So they're saying that please don't make it cheap, like abdominal surgeons don't say half an hour hernia or 2 hours of gastrostomy and all that. Now standalone physician centers, you have the full autonomy. Now if supposing I own the center, which I do in Gurgaon with my wife, then we decide the schedule, we decide when the surgeries have to take place, who's going to be our OT assistant, and so on. It increases the efficiency, it becomes cost effective, because sometimes we multitask the staff, and we are very quality focused, which you cannot do if there are multiple surgeries happening in the same. Now, the pros are, as I said, autonomy, and of course the financial incentives. You make your profit from the surgical fee, you also get some profit from the ambulatory surgical center expenses. However, everything is not positive. First thing is your management responsibilities. Physicians handle all the administrative tasks here. Even though you may have an employee called a CEO, you still are the final person to make the answer. Second thing is financial risk. You are building a financial center, say in Bombay or Delhi, it's a big investment, and you have to be sure that you can recover it. Now, corporate-owned ASCs. These are managed by healthcare corporations. As you know, there are many in America and there are few in India. The first one was from the south of India, which went into liquidation. Then there is the advantage they have is scalability. So if they have 150, 200 centers, so when they buy a operating microscope, they'll order 40 pieces together. they're bound to get a better rate and better terms than what one person buying one piece is. Second is operational efficiency. So they'll have the same method of operation across the board. Third is financial stability. So if one center is losing money, hopefully the other center is making money, and you can write off the expenses from that. The challenges are there's less physician autonomy because now you're directed by shareholders, profit-driven decisions. So they'll say, if a patient has got a pressure of 22 with cataract, why not you put an eye stent along with phaco? Third would be the offers advanced care, financial security, and operational efficiency, but with reduced physician control. Now, corporate-owned also have their pros, operational expertise. Corporations bring in managing ASCs, leading to streamlined operations, reduced administrative burden on the physicians. The contraindications are limited physician control and profit distribution, because now you're sharing it with others also. In the case of non-profit, it's a mission-driven thing. So the classic examples are your Shankar Nethralaya, the Arvind, and these kind of hospitals, which focus on community healthcare over profits officially, and hospital and institution affiliations. They're often linked to universities or healthcare systems in America, like the Wills Eye Hospital and so on. Third is the high quality care. They prioritize patient outcomes over revenue. So you'll find that poor patients also get quality surgery. Now the challenges here are that you have to have good funding. You have to be slower decision making, because they won't rush into buying an excimer just because somebody's saying refractive surgery should be done. They'll make sure that it really is viable and the community can afford it. It also ensures equitable, high-quality eye care with the patient-first approach, which is the ideal approach when we train as doctors. So now there's a comparative analysis as we've gone through it. So what are the control factors? One is control. In one case, you have full physician autonomy, and in one you have corporate-driven, in the third you don't. Financial implications, as you can see, there's higher investment in standalone, shared investment in corporate, and grants and donations for non-profit. Management responsibilities, again, are independent over here, but shared in corporate with the experts, and non-profit, of course, will be having its own team. The community impact is the important part. The focus here is on patient satisfaction and efficiency in a private ASC. In a corporate one, is profit-driven. They have a weekly meeting. How many procedures each surgeon is doing, how much profit is he bringing, should he be kept or asked to go. And the third is the non-profit prioritizes accessibility and affordability, and everything else follows that, like in the LVP model. Now, these are the case studies of standalone, corporate-owned, and non-profits. I won't go into them. I've already talked about quite a few of them. So there are a lot of these. I was actually the path breaking after orthopedics to invent the concept of ambulatory surgical centers. Then case studies in India. So one is ours. The other is Dr. Agarwal's Eye Hospital. Then you have the Arvind Eye Care System. Then considerations for choosing. Now it depends. What is your financial goal? Are you profit-driven? Do you want to be the controller and decision maker yourself? Or can you take the risks that go with it? Are you looking at growth and expansion, or just one single ASC? And what are your community objectives? Are you interested in doing community work, making it accessible and affordable, or would you like to treat the elite and make your profits? So in conclusion, though there are different models, each has its own strengths. Standalone offers control, corporate ensures scalability, and non-profit prioritizes accessibility. And as I've explained before, that the important thing here is their financials are the important thing, followed by operational and community impact. And last but not the least, is alignment is the key. The best model depends on your financial goals, your risk tolerance, and your commitment to patient care. Choosing the right model should align with stakeholders' objectives and community needs for long-term success. Thank you very much. If there are any questions, I can take them if there's time.
Very well, I think, covered, sir. I think very comprehensive view of the different models available for an ambulatory surgical service. Thank you very much, Dr. Sethi. You can probably take your seat here.